Hello, welcome back to our final sessions of the day. Really hope that you've been enjoying all of the conversations so far, and thank you for the questions that have been coming in too. So, we're going to kick off this afternoon with our final keynote speech. It's being delivered by Rosa Wilkinson, Director of Policy, High Value Manufacturing at Catapult. Rosa will be discussing supercharging growth through innovation to help levelling up. So let me welcome Rosa to our virtual stage.
Very much, and hello everybody. Really good to be with you today. I've caught one or two of the sessions that have happened through the day in betwixt and between other things, and I have to say it sounded like you've had some fascinating discussions. Now, I'm going to be slightly unusual here. I want you all to think for a moment that you are therapists, because I'm going to begin by telling you about my childhood. Now, some of you will already have spotted, and I'm going to say to the guys in the control room, please don't turn off my mic at this stage. I know you're based in Manchester, but some of you will have spotted from my accent that, in fact, I am a very proud Yorkshire woman. I was born in Sheffield, I grew up in Doncaster, and my home was surrounded by my family business, which was a small industrial estate just on the outskirts of the town. And that industrial estate was a hive of activity. It was populated by the small businesses that fed into the region's principal supply chains, into the mining industry, into steel, into the heavy industry that characterized the south of Yorkshire. But as I was growing up, that landscape, that industrial landscape, was changing. The mines were closing, the steelworks were sputtering. Frankly, decent jobs were disappearing at a real pace. And as a result of that, frankly, industrial unrest was growing. And in the 1980s, that really reached a peak. And it reached its crescendo, for want of a better word, during the miners' strike of the 1980s. And some of you may recall something that became known as a battle at a little place called Orgreave, which really was not very far down the road from my home. I really remember what those days were like. I remember the tension. I remember the feeling of a community being left behind. If I'm honest, we'd become the embodiment of that phrase that you hear bandied about, of it being grim up north. And so, like very many graduates from the region, I moved away and I came to London. I joined Her Majesty's Civil Service, where it was entirely possible that I could have swallowed the idea that manufacturing was a dead duck in the UK and that we didn't make anything anymore. I'm glad that I didn't follow that line of thought, because the reality is that the UK remains in the top 10 of manufacturing countries in the world. And we're 8th on the list, by the way, if you want to know exactly where we are in the league table. Our manufacturers employ around 2.5 million people, usually at average wages, which are about 12% above the average for the whole economy. And those wages pump prosperity into communities in every part of the land. Those manufacturers I was talking about, they're responsible for about 10% of the UK's GDP, 64% of all of our investment in research and development, more than half of our exports. And as we came to learn, I think perhaps most keenly during the pandemic, they are absolutely crucial to our national resilience. Because the reality is that it's our manufacturers who really are at the heart of providing solutions to the most difficult challenges that we face today. It's our manufacturers who are the people giving us the tools that will help us transition to net zero. It's our manufacturers who will give us the vaccines, the medicines, and the ventilators that protect us, heal us, keep us well. And let's be honest, it's our manufacturers who put most of the food on our tables and the clothes on our backs. So manufacturing really does matter. And here's the thing, because manufacturing is so widely distributed across the UK, I believe that manufacturing is also at the very heart of levelling up communities. Let me explain why. I began my remarks by talking about what I saw happening around me as I was growing up in South Yorkshire. I talked about Orgreave, where industrial strife found its crescendo, decline, unrest, a complete lack of hope. It truly was grim up north. But here's the thing. If you go there today, it isn't. If you go to Orgreave now, life is rather different. What you'll find is companies jostling to invest there, from small firms buried deep in supply chains, but also the big guys, companies like Boeing, McLaren, Airbus, Nikon, BAE Systems, Rolls-Royce. You'll find thousands of new jobs paying those above average wages that feed down into wider community prosperity. Why? What was it that attracted them to a region where, frankly, hope was lost? Well, the transformation actually began back in the 1990s when a professor at the University of Sheffield was working on a project with Boeing. Now, at the time, academic research, which we're famed for in this country, but that research didn't always filter down into the real world of manufacturing companies. It just didn't really get through. As a nation, we were utterly brilliant at research, but we were falling well short on translating that brilliance into leading positions in industries. And too often, we watched from the sidelines as our research excellence was turned into economic value in other countries. Now, that's a problem, but it was a problem that spawned a great idea. Just what would happen if we created a mechanism that bridged the gap between the cutting edge research that was happening in our university labs and the day-to-day needs of production lines? Well, in 2001, that idea moved from the page into reality with the birth of the University of Sheffield's Advanced Manufacturing Research Centre, or AMRC, as we more usually call it. It was soon to be followed by its younger sibling, the Nuclear Advanced Manufacturing Research Centre, and soon to join a wider network of organisations, the Catapults, of which mine, the High Value Manufacturing Catapult, was the lead organisation. And what the Catapults did was bring together government, academia, and crucially industry to make change happen. And the Catapults bridge that gap, that chasm that existed between research and industry. We work to turn brilliant research findings into the commercial propositions that attract venture capital investment or can be licensed, and that can put the UK ahead in today's and crucially tomorrow's markets. Now, today, there are 9 catapults in total, physical centres with cutting-edge R&D infrastructures, hubs, labs, test beds, that sort of thing. But crucially, also the technical experts that can work with companies to prove and adapt breakthrough products, processes, services, new technologies. We're part funded by government through the brilliant Innovate UK, and we work with thousands of innovative businesses right across a wide range of sectors. Mine, the High Value Manufacturing Catapult, is now the biggest by a country mile. We've got over 20 locations right around the UK, but there are also catapults covering, now let me see if I can get all of these, but certainly covering satellite applications, cell and gene therapy, medicines, digital technologies, energy, transport and the urban environment, and crucially, because let's be honest, it rules our world these days, compound semiconductors. And we exist purely to help companies improve their competitiveness through accelerating innovation, translating research into innovative products, the things that our world needs, leading and coordinating the action that's needed to transform sectors that might have been flagging and make them fit for the future. Now, Back in 2011, when we were first founded, the High Value Manufacturing Catapult was unashamedly focused on the technology aspects of innovation. But here's the thing, if you think down silos, it's harder to make change happen. So today, we're doing much, much more to make sure that the whole ecosystem for innovation works and to give businesses the confidence that they need to invest. And for us, that means thinking about the skills that businesses will need to harness the power of new technologies. It means helping connect the firms we're working with to sources of capital to finance their innovation. And it means making sure that firms can connect with expert advice and more so that their bottom line grows and strengthens. You know, all things that will make businesses feel confident that any investment that they invest in doing something new or making something new will deliver a return, will shore up their bottom line. Because, you know, for me, confidence is probably the biggest barrier that we face to industrial transformation here in the UK. It's the thing that really puts a roadblock in the transformation of our industries. Our habit is to cling on to old ways of doing things. We nurture our old kit. We hesitate before we embrace the new. Why? Well, I think it comes down to a single word: fear. So often we go out of our way to protect the status quo, even when that status quo is actually holding us back. We do our utmost to avoid change if we can. But whilst that might offer some protection from risk at an individual level, if we carry that forward into the business environment, it actually exposes us to greater threats, things that we really should be afraid of. It makes us much less likely to evolve in step with the changing aspirations of customers, much less likely to keep pace with our competitors, much less resilient, much less likely to tackle problems that might occur in our existing operations. And that's why it's so important that businesses are able to find their way to organizations like mine, the HVM Catapult, that can take them by the hand and help them to overcome their fears, manage their uncertainties, and punch high in terms of getting new things done. Organizations and people who give them access to the know-how and the tools that they need to develop new ideas, embrace the opportunities that are created by new technologies, and manage risks that they might face as they take the next steps into what could be a glowing future. We're people who can hold their hands and give them the confidence to feel the fear and do it anyway. Now, today, I'm hugely excited to see some of the developments that we're helping our manufacturing deliver. Engine systems and alternative fuels that can cut the carbon emissions from transport, technologies that will keep the lights on without fouling our atmosphere, off-site construction methods that will allow us to build the new homes, the schools, the hospitals that we so desperately need, alternatives to plastics that help tackle the scourge of plastics waste, products and processes that reduce environmental impacts across the board, that drive down costs, that make firms more competitive. And that matters because those developments, that innovation, will not only deliver a better world for all of us, it will also help to keep the UK's manufacturers at the forefront of some growing global markets. It will deliver the lasting, high-quality jobs that make communities prosper. And I think that that's what we all want to see. For me, manufacturing has the power to transform the UK for the better for all of us. It has the power if, and it's a jolly big if, our manufacturers are ready and able to seize the opportunities for change which are being created by new technologies. And today, I believe that with the HVM Catapult's industrial foresight, and by working with us and our partners, and with the right support from government, our manufacturers have the power to deliver just that. I believe that they can double the value that their sector generates, that they can grow the number of people they employ in those high quality jobs paying those above average wages that boost the prosperity of places right around the country. They can tempt more high value inward investment into the UK and be part of transforming more of those places left behind by industrial change. We in the HVM Catapult reach out into every corner of the manufacturing world. Whether it's a cluster in the process industries, food and drink, aerospace, automotive, energy, whatever, we can help to give it a real boost. You know, in 20 years' time, when we look at the world around us and when we reflect on the companies that have succeeded and grown, we won't be thinking about the firms that close their eyes to the way that the world is changing. We'll be celebrating the firms that seize the agenda, transform the things that they make and the way that they make them. The sectors and the subsectors that take a global lead will be those that really embrace change. They are the companies that will deliver a more resilient economy and the people who will boost the prosperity of every manufacturing community, every town, every cluster. And that's why I celebrate innovation, celebrate change, if you like. I want my organisation to be part of helping to make it happen and making sure that it delivers the things that, frankly, we all need. And as part of that, I want us to be working very, very closely with every local authority, with every combined authority, adding to its industrial strategy, making sure that it packs a punch for the citizens that it's trying to nurture. Geeta, that's it from me. I'm happy to take questions if there's time, but I don't know that there is.
Thank you so much, Rosa. We don't have time for questions, but if anyone does send them through, we'll try and get them to you. What a wonderful keynote, really, truly inspiring. Thank you, Rosa, for closing our keynote speech this afternoon. We do have one final session, though, one that I've been really looking forward to, which is all about health and well-being. Now, the aspiration is that by 2030, the gap in the healthy life expectancy, known as HLE, between local areas where it is the highest and lowest will have narrowed, and that by 2035 it will rise by 5 years. Additionally, by 2030, well-being should have improved in every area of the UK, with the gap between the top performing areas and others closing. The question remains, how will local leaders achieve this mission, and what are the hurdles that we will need to overcome? Well, joining us to debate this and to ask the pertinent questions as to how leaders are to navigate this issue, we have Sadie Bichon, Public Health Principal at West Northamptonshire Council, Geraldine Munmace, Lead Nurse at North Thames Paediatric Network, and Charlotte Merrill, who's Advanced Public Health Practitioner at Plymouth City Council. Welcome to you all, and just a reminder for our last session, if you do have any questions during the session for our panelists as they're talking, please do pop them into answer your question, and I will keep an eye on those questions and put them to our speakers. Well, welcome to all three of you. We're so delighted to have you here for this final panel discussion. It's always great to get a sense of your specific roles, and I guess just to kick us off really, you know, how you see health and well-being playing into this bigger idea of levelling up. Sadie, why don't we start with you?
Yeah, thanks. Hi, everyone. So my role in the public health team in West Northampton Council is predominantly around the wider determinants of health. And so we're talking about the built natural environment and socioeconomic environment when we say wider determinants of health. and they have a huge part to play in health and well-being. And when we're talking about levelling up, they also have a huge part to play, those wider determinants, that infrastructure and access equally across different groups. So yeah, really important to focus on the wider determinants with levelling up.
Thank you, Sadie. Geraldine, give us a sense of what you do, your focus currently, and yeah, your kind of feelings around levelling up it and health and well-being.
Yeah, of course. So I work for the North Thames Paediatric Network. It's a overarching sort of framework which sits above nationally funded operational delivery networks in the UK. So meaning essentially we're a core team who work very closely with our providers, our regional commissioners, our integrated care systems, and our patients to really realise change across complex systems of care to ultimately improve quality of care and outcomes. So, you know, hugely pertinent. So our three main functions are really to share learning, to coordinate, to act a little bit as a relationship manager, as it were. So bringing people together and address unwarranted variations with the goal of improving quality of care and really managing those patients' flow. So with looking at all of that, we look at making sure that patients receive care from the most appropriate provider as close to home as possible, with quality of care across the area improving. So essentially, we ensure equity of care. It shouldn't matter where you live in London, because North Thames is in London, the network. You should receive the same standard of care and have the same access to care wherever you live in the city.
That's great. Thank you, Geraldine. Charlotte, what about you? Give us a bit more of a sense of your current role and again, an outline of the connection with levelling up.
Hello, yes. So I currently work within the children's team in public health. I'm a registered dietitian as well. So I have a big interest in food and nutrition, particularly around the commercial determinants of health, food policy, changing food systems. Within my team, I've got two main work streams at the moment, which are both linked to supporting better health outcomes for children. So trying to change the culture around breastfeeding. So we see more women breastfeeding for longer in Plymouth, particularly in our more deprived areas where we've got rates, and creating a healthy system for our families so it's easier for them to take up health promoting activities and choose health promoting foods that will improve their health and well-being. So we have a sort of strategic action plan, which is 10 years long. It's effectively our childhood obesity strategy, and the approach is aiming to improve the health and weight of our children, young people, and families. And this is whole systems and looking to create those healthy systems to make it easier for them to be healthy. We're moving away from focusing on KPIs to developing our thinking on indicators for the healthy system. And that's looking at, big public health data and qualitative stories and feedback. We're aiming to be in a process of continual learning where we feedback what we receive from individuals, groups, and places in our community, so that can be used to help to change the way that we work and collaborate with our partners, so that the offers of support that we deliver are tailored to the needs of that community and led by that community, with a focus on networks and relationships rather than just providing a service. And this way of working recognises complexity of the issues within our system and the diversity of our populations, and helps to reduce health inequalities by recognising that not all the families that we work with will find it easy to engage with the universal offers that we have.
Brilliant.
Sorry, that was quite long-winded.
No, it's great. And it really gives a sense of the breadth of knowledge that you all have. So, whilst we're here together, just a reminder for those who are watching and joining us today, do pop in questions if you have them. It's a really great opportunity to put them to our experts. Sadie, let me come to you. Why is focusing on health inequalities important when it comes to closing the gap in HLE, which I mentioned earlier?
So I think it's really important that we understand why there's a gap that exists in health and life expectancy, and looking at some of those health inequalities, you really start to unpick why the gap's there and who's kind of experiencing those gaps. So, I mean, if you take even just health inequalities in women, so women in the least deprived areas in the UK live 21 and a half more years in life and good health compared to the most deprived. So you can really start to see the differences between those population groups that live in those different areas. So yeah, it's really important, I think, to understand which groups are most effective and what those poor outcomes are for those groups when we're talking about healthy life expectancy.
Thank you, Sadie. Geraldine, what are the main wellbeing and health issues in your speciality area that you're seeing?
Yeah, no, that's a really good question. And I'm actually really happy to see that Charlotte's on the panel as well. So we are going to be, I suppose, focusing on children and young people quite a bit, but I think it's extremely important to do so. So sort of in our area, and as Charlotte alluded to as well, we do see the link between the poorest outcomes and health inequalities, with higher asthma rates and higher levels of obesity reported in children from ethnic minority groups. They're actually twice more likely to be obese in certain areas. And also children from the most deprived areas in London have more than twice the level of tooth decay than those in the least deprived. I think we can also look at other specialities within our network, such as epilepsy, for example. Children and young people from groups more likely to experience marginalization may struggle to access services they need and may have a poor health outcome because of that, due to various factors, culturally and language based as well. And I think it's just really key to highlight just some of those differences. So young people who live in the most deprived areas in London are 2.7 times more likely to become pregnant and actually twice more likely to die in adolescence. So I think that's quite a pertinent figure. And we see this real clear association between the risk of death and the level of deprivation for children who died in England between sort of April 2019 and March 2020. So those are sort of the main sort of issues, health issues that we focus on within our network. But I think this is really, it's quite important to highlight those in the backdrop where we're also looking at children and young people facing growing waiting times for vital community services, which impact their health as well. We're looking at, a rise in demand for mental health services, for example, a burnt out workforce. So there's quite a lot of intricacies in that too. And sorry, just final point, because I think it's quite important to highlight this. Obviously, we see our health inequalities within our speciality. So, obviously in respiratory, the asthma, the obesity, epilepsy, mental health within, pockets of where you live. But I think it's really important also to highlight quite an interesting health inequality, as it were, between children and young people and adults. Obviously, we are a pediatric network, but we focus on sort of the elective recovery waiting list. So I think everyone knows that during the pandemic and because of it, we've seen a huge rise in elective recovery waiting lists. It's a really huge backlog. But I think what's quite interesting is that elective recovery waiting lists have increased significantly faster for children and young people than they have in adults. So just to sort of bear that in mind as well. And I'll stop there.
No, it's great. Thank you, Geraldine, for sharing all of that. Charlotte, as we are talking about health inequalities, we've heard there some of the health inequalities that Sadie and Geraldine have talked about. I just wonder how, your plan in Plymouth is targeting targeting these specific health inequalities to make a difference.
Yeah, so part of our 10-year strategic action plan, we are testing an approach in one of our areas of highest deprivation with a population where we know we have reduced health outcomes compared to other areas. Families have less access to healthcare, transport links and facilities due to their location and the financial resources at their disposal. Our NCMP data shows the highest prevalence and number of children with a higher weight in this area. So what we're calling this is our our enhanced offer. So we're in one of these areas where we've got, we know we've got poorer health outcomes and highest levels of deprivation, and we've brought together around 30 partners in place who can collaborate to impact the health of these families. And the idea is that we are working collaboratively to enhance the available health promoting offers for that area, so pooling resources to increase access to similar offers that might be available in other parts of the city. And we're just learning, feeding that learning back in all the time so that we can create the best offers in that place, and then see what effect that has, from the learning that we gain, and whether that can be moved elsewhere into other parts of the city where we know we have similar issues.
Yeah, and you mentioned the word collaboration there, Charlotte. I mean, Sadie, how important is collaboration in order to achieve these goals? What are you finding where you are?
So I think it's vitally important when we're addressing complex issues that I've got multiple organisations that can be involved in unpicking and solving these issues, and multiple players. We've got different groups of people that are affected by them. So in order to kind of come to a solution that's going to work for all and address all those different elements of these complex situations, you need to have all of those people around the table working together, working collaboratively to address those issues. And it might be that some of the issues that we talk about, such as that are contributing to the healthy life expectancy around the kind of wider determinants of health, such as employment issues that people are facing. But if those people that are facing those issues have are most frequently accessing their health services, and that's their kind of access point, then in the health service side, they're not necessarily equipped to solve the employment issues that could then help their health issues. So I think it's really important to consider the wider determinants and what other players we need to bring together, and all the expertise that we have in the room to address these issues.
And Geraldine, you outlined some of the health inequalities earlier. Do you have examples of how you're actually reducing health inequality?
Yeah, so I just wanted to touch upon the point of collaboration. Obviously, that is what we sort of do. That's sort of our ethos in the network and how important it is. So just to agree with Sadie and Charlotte, it's really collaboration. Bringing across all those providers, our regional commissioners, our integrated care systems. They all have their priorities and working in silo really, but we're really trying to bring that all together, and I think it's absolutely crucial to do that to move things forward. In terms of some of the examples that we're doing in the network, we really used the Core 20+5 initiative in our program of work. It's designed to support ICSs and others and partners to drive targeted action in healthcare inequality improvement, but specifically in children and young people. So it was great that came out, specifically for that cohort of people really, and it really focuses on asthma, diabetes, epilepsy, mental health. So we work very closely with our ICS partners, with our ICB board. So that's really great in that collaboration. So around epilepsy, for example, we did see that there is a really sort of a lack of access in sort of getting that specialist care. So working with our ICSs to ensure that we increase access to epilepsy specialist nurses, improve understanding in sort of in different cultures and religions, tailor communication for young people, including ensuring there's translation services available, ensuring supporting young people with accessible tools and simple technology. So really working closely with children and young people, understanding what they need from this and understanding how we can provide a better service so that they actually access health, because I think there's really a moment in young people's lives where they just need that sort of that support in terms of accessing the correct health and knowing how to bridge that gap. We had a really big issue with tooth decay, oral health in in East London, and we could really see, as I mentioned, that it was in a particular sort of area, a patch in our network. So we really we rallied, we really sort of spoke with our regional commissioners, with our ICSs, and really tried to find a solution to this, because the number of children needing tooth extractions in hospital for under 10s, so was just huge. It was absolutely huge, and we knew that we had to address this. We knew that we had
of East London population. So
we got some funding, and we essentially launched a 3-theatre general anaesthetic unit dedicated to dental treatment under general anaesthesia back in October 2021, where we operated 36 lists a week. So really actively delivered over and above current capacity to try to tackle that backlog, and we did see very positive results trying to get that backlog down, and just essentially getting these tooth decay sort of sorted out, as it were, in that particular area.
Oh, it's a really tangible example there. Thank you, Geraldine. I've actually just seen a question's popped in from our audience, so I'm going to read it out, and then whoever feels like they want to answer, just either put your hand or just go for it. This is a question from Marion. Marion asks, how much do you think housing is having on health inequality, so security of tenure and standards? Sadie, I can see you nodding. Is it something you'd like to comment on?
Yeah, definitely. So it's a massive part. I think that's contributing. So again, a massive wider determinant of health is housing. So yeah, access to that safe tenure, and the ability to sustain your tenure, so that then you can bring in things like employment security as well into that. But yeah, we see definitely a lot of health inequalities when people have who are living in social housing more so than not. And people that are at risk of homelessness, their health risks go, and impacts on their health are significantly increased. So yeah, definitely housing is a huge part to play in it.
Geraldine or Charlotte, would you like to add anything?
Yeah, I'll jump in. So we've actually made place and housing our next priority for our Thrive, Plymouth Thrive project. So this is our kind of health inequalities strategy, where we work with stakeholders and partners over a long term, and we have different areas of focus. And this year is actually all around housing in place. So it's we're seeing that as an enormous priority at the moment, particularly with everything that's going on with the cost of living and how people will be moving from secure housing to not secure housing, and the issues that we have around housing, people who are in temporary accommodation as well. So it's definitely something that we're aiming to focus on over the next year.
Yeah. Geraldine, is there anything you'd like to say?
I mean, where we sort of touched upon housing is possibly with our more complex patients. So our patients with respiratory support, so who live at home with some sort of ventilator support, children on long-term ventilation, we have noticed it's really, really challenging in London to get the appropriate housing, and a lot of families with children on long-term ventilation, complex children, are needing social housing, but getting the appropriate housing with children on long-term ventilation is extremely difficult, and it creates very big sort of capacity issues and issues for those families, because they end up staying in hospital for up to 2-3 years just waiting for the appropriate housing if they're going through social care, because they need certain things sort of ticked off their list in terms of having a child with complex needs at home. So yes, there's a sort of huge impact with that in terms of the sort of well-being and health of the family in general, having to imagine sort of live in a hospital for that amount of time.
Okay, thank you very much. And thank you for that question. Really great question. And we've actually got one more question that's come through. So I'll just read this one. This is from Rebecca. What do the panel think is the number one thing transport can bring to the table when it comes to tackling health inequalities? So the role of transport with health inequalities. Is there anyone who'd like to pick up on that?
I will, if that's all right. So again, I think it's one of those wider determinants issues. So with transport in our area in particular, we're looking at kind of the ability to use more sustainable methods of transport and looking at active travel as well. So at being able to walk to work, walk to school safely, and use it as a form of exercise. And not only kind of it's good for your mental health, getting out into green space, that exercise, it's good for healthy weight. But then if you're using more sustainable methods of transport, then you can start looking at reducing your carbon footprint, and so helping lower air quality issues in the area. So again, having positive impacts on your health. So yeah, I think there's lots of positive contributions travel can bring.
Geraldine, yeah.
Yeah, no, I completely agree with that, and it's a really that's you sort of one way of looking at it. Completely agree, and I suppose again my examples of how we see sort of transport and health inequalities play is more to do with children not being able to come to their follow-up appointments, for example. So if you don't come to an appointment, you're as an adult you're put down as do not attend. As a child, you're put down as was not brought, because someone physically has to bring you to your appointment if you're a child or a young person, and that just comes down to sort of transports. There's certain families who can't bring their child to a follow-up appointment because they don't have a car, or they can't afford the transportation, or they've got other kids who they have to manage and take to school or so forth. So we do see that a lot in our data when we look at follow-up appointments or coming into certain procedures, things like that. If we see was not brought, there's quite a big link to transport and access to having that transportation to actually bring the child to their health appointments, which obviously has a factor in health inequalities.
Yeah, and Charlotte, is there anything? I saw you nodding at one point. Is there anything you'd like to add?
Yeah, no, I mean, I agree with both of you. I mean, I've been watching, I don't know if anyone else has been watching How to Live to 100 and the blue zones and that, and I'm just like, right, we need to do that everywhere, come on. But on a more Plymouth-based note, we do have lots of plans like yourself, Sadie, to kind of increase our our population's access to sustainable travel and active travel and everything else. But from a kind of place-based perspective, what we've seen emerging from the collaborative work that we've been doing with that group in that particular area is that transport is a massive issue for families in that area. They're very isolated. They it's not just accessing healthcare, but accessing anything that's going to improve their well-being, really, and they're not connected as a community as a consequence of the lack of transport in that area. And children, for example, in the local school are not able to. We live near the coast, we live near the moors, we've got all these beautiful blue and green spaces around us, and these children, for various reasons, because of their families not being able to afford it, and the school can't afford a minibus, there's transport again that's impacting on their health and well-being there. And so we're working with our partners in that area to try and see if we can move anything to improve that for them.
Yeah, and it just made me think as well of a documentary that I was watching. By the way, I love How to Live to 100. It's fantastic on Netflix. For anyone who hasn't seen it, I would recommend it. Other platforms are available, obviously, not just Netflix. But also I watched, I think it might have been Countryfile, a program like that, where it was about a community that lived just outside the Lake District, where there were high areas of deprivation. And these young people had never been to the Lake District, which was sort of, within 20 minutes from where they lived. And it was really down to inequality, you know, and then the charity organised transport, and they got to do all these wonderful things, and you know, just very simple steps that can make such a difference. Thank you for that question, Rebecca. Fantastic question. I'm just conscious that we've only got a few minutes left, so I thought it might be good just to kind of end, you know, this is our last panel discussion of the day, but with one final question, really, to, you know, the same one to all of you, which is what needs to be done. If, you know, I appreciate there might be lots of things, but if there's one thing that you would want to kind of focus on, what needs to be done to ensure that levelling up goals are met when it comes to health inequalities? Geraldine, I'm going to go to you first.
Yeah, I mean, probably no surprises to everyone here, but I think for me, it's really a continued collective effort is really needed to champion the needs of children and young people, that all programs of work need to ensure that young people and children initiatives are explicitly included, that there's investment that benefits UIP populations, the children and young people population proportionately to the one of adults. Childhood has major implications for future education and health outcomes, with health problems more likely to develop among adults who experience childhood disadvantage. So yeah, just let's focus on our future and really champion the needs of children and young people.
Thank you, very well said. Sadie, what about you?
So I think for me, again, no surprise, the wider determinants of health, and I think, yeah, just a real emphasis on that prevention approach and understanding, yeah, how we need to address the wider determinants of health in order to reduce those health inequalities.
And Charlotte, last word to you.
I would echo what both of you said. I think focusing on children is really, really important, and embedding, you know, children's voices in policy at every level. And also a passion of mine is the commercial determinants. So how do we locally affect what is happening nationally so that we can, you know, support our populations to be more healthy in the environments that they're living in.
Yeah, brilliant. Thank you so much to all three of you. You know, honestly, such a powerful conversation, and I'm sure everyone has taken so much from it. Thank you, Sadie, Charlotte, and Geraldine. And that's us coming to the end of our conference on levelling up. Really hope that you have enjoyed everything that we've covered today, the challenges, the opportunities, and the solutions as we discussed public sector levelling up. Whether you are one of our excellent panelists who've been with us today, or if you're part of our audience, we do just want to say thank you for being a part of today, sending your questions in and sharing your insights and expertise. So thank you from the whole team here at PSE-365. Now, before you go, just to say thank you to our fantastic partners, without whom this event just wouldn't happen. Our next event is on learning and development, which takes place on the 8th of February. So please do share that with your colleagues, as we would love to welcome some more new faces to the platform. Today's event, as I mentioned right at the start, is CPD certified. So that's 1 CPD point earned for every hour of live content that you've watched. Your CPD certificate will be sent to you within 24 hours, so do keep an eye on your inboxes. From me and everyone at PSE-365, a big thank you for being such a great audience. We really hope that you've enjoyed the conversations today, and we will see you next time. Goodbye.